not in the suburbs. Most of them are in the city of Chicago, and that kind of makes me a little sad, but that's just the reality of our universe. So SAMHSA, if someone wanted help, this is where they could go. This is one of the best places they can go. Another option that I didn't even put on here, though, obviously, is a doctor. If you have a primary care doctor, they can refer people somewhere. You could also call me. Illinois Helpline and helplineill.org are two other places. Next, I want to talk a little bit about medication-assisted treatment, MAT. So MAT, the most popular versions of medicated assisted treatment are methadone and Suboxone, and then there's another one called Vivitrol. So these are medications that are given to help people wean off their addiction. So methadone clinics, sure, a lot of you those have had a bad rap over the years, right? Because they were not monitored well, and there's still some that are not. They are just in it for the money. They get X amount of patients in there, or clients. They get X amount of money from the state, but there are some good ones. Methadone so the methadone clinics work. They come in, they get a certain dose of methadone. It's like in a little plastic shot glass almost at different levels, and they kind of wean them down. Methadone works great for people that want to get clean and that also do other counseling and therapy with that to address the mental health issues. There's a reason people use drugs, right? They're usually trying to cope with something, whether it's pain, loss, grief, trauma, whatever. And those things have to be addressed in order to address the addiction. So when I was working in the city of Chicago, I had a client who had been on methadone for 20, 30 years. The very lowest dose. He started out, at like an 80 milligram, down to like a 10 milligram, been there for like 10 years. I would ask him, why don't you just get off of it? He goes, it's my safety blanket. As long as I'm taking that, I'm not going to go buy a bag. I know I'm going to just stick with this. It's going to keep those cravings away. So that's a good example of the program working. He's on it. He's taking it. It's keeping the cravings away. He's going to treatment. He's going to groups. He's talking about why he used all those things. The other one is Suboxone, which is in the world of addiction relatively new, but it's been around now for a while. Suboxone kind of works the same as methadone. It's like a film that goes on the tongue and dissolves. Same thing. It helps people dose down. The biggest issue that they have had with previous years, and still now the issue they can have sometimes with methadone, and they also have with Suboxone, is at a certain point, clients are allowed to take home a supply instead of coming into the clinic every day, and then they can sell that supply on the street if they so chose to. But other than that, both programs, again, aligned with some kind of counseling or therapy, have proven very successful. The other one is Vivitrol. Vivitrol is used more for alcohol addiction. It's a monthly shot that takes away the cravings, but it has been shown in some cases, and I don't have numbers or statistics, where it has helped people with heroin, opioid addictions as well. Excuse me. And then there's the detox inpatient 12-step meeting. So that's kind of like a treatment model. People will often go in for detox. So you cannot die from heroin withdrawal. I think I mentioned that already, but you can feel like you're going to die. So people can go into, there's, several, used to be able to go just about anywhere, but now there's certain hospitals that do handle detox specifically, and it's kind of medicated assistance so people can detox safely and don't go back to using to kind of get rid of that dope sick. The problem with the detox for some people is they detox, they're in there a couple of days, they feel great. They're like, all right, I got this. I don't need anything else. I'm going to go home now. But they don't treat the mental part of it, and they go right back to using. So detox plus inpatient counseling is the best. Inpatient usually runs on anywhere from 21 to 28 days. In my opinion, that's not nearly enough time. It takes you years to become addicted. Now we're going to tell you got 3 weeks to kick it. That's ridiculous. If I ruled the world one day, it would be a year long that insurance would have to pay for that. And then there's also outpatient counseling, which there's different levels of that. And of course, 12-step meetings. So AA, and then there's NA, Narcotics Anonymous, HA, Heroin Anonymous, there's CA, Cocaine Anonymous. There's all these different factions of it. Many of my clients, when I worked in Chicago, on the west side of Chicago, we actually went once a month to a treatment facility to their AA meetings once a month. Going into an AA meeting and being a heroin addict is fine. It's not like you have to stand up and identify the drug you used. An addict's an addict is an addict. 12-step meetings, definitely a lot of success with those. A lot of controversy with them though too, based on the higher power and different stuff like that. But I have seen a lot of success with them. I would attend the meetings with my group and I actually enjoyed them as well. So, all right. And then, so that was the help for Danielle. So now here's the help for the family. So if Danielle goes or doesn't go, whatever it is, right? But here's where the family can go and get help. So Al-Anon or Nar-Anon for alcoholics or narcotics. So this is a 12-step program basically for family members of individuals battling addiction. If you know someone, if you love someone that is dealing with addiction, these meetings are a place you should be going. When I was working daily with people dealing with addiction, I was going to Al-Anon meetings because it's a way to kind of process that client that I'm trying to help that's not getting better and how this isn't my problem, this isn't my fault, okay? Then there's Alateen and Narateen, same thing. Those are for teens. So that would be where the younger sister could go, where Dana could probably go and get some help and some support. Many meetings, most meetings right now are actually held virtually due to COVID-19. There was a spike in overdoses and people using again when COVID hit because these 12-step meetings were their lifeline and those stopped happening. And it took a while to kind of shake everything out. There are people that have suffered from addiction, have been sober for 20 years, but still have to go to a meeting every day to maintain that sobriety. And COVID took that away from them. So there was definitely a spike in such things. There's also family counseling, individual counseling, education on addiction, and just taking care of themselves, practicing some self-care. So the last couple things I want to talk about, I don't have a slide for it, it's just me, is the opioid epidemic as it's come out here is kind of I use the perfect family as an example of kind of how it's grown out here. So kids in the suburbs started using mom and dad's pain pills, finding them in the medicine cabinet, say, stuff like that, and became addicted to them. Kids, adults, a lot of people, if something's in a pill form in a bottle from a doctor, it's okay. It can't hurt me. And then what happens? You become addicted to it. So there's a little stretch of highway here, 88 to 290, that is known as the heroin highway. So this is basically where from the suburbs, you go down, you get off on Independence, and there's a guy at the end of the ramp that you give your money to, and then you turn around to get back on 290, and that's where you get your bag from. The drug dealers have set up houses out in the suburbs so that kids don't have to travel as far. But that's kind of where that's how it started out in the suburbs. That's where the opioid epidemic came from, because those pills became harder to come by and too expensive to purchase. And then they found out they could go get that bag of heroin for $10 on the west side of Chicago. So business is booming down there. And unfortunately, kids and people all over are dying. The other thing with overdoses that I think is important that everyone knows, when you hear about the overdoses, there's usually a couple of reasons for an overdose. One, it's been laced with something like fentanyl. The reason that dealers will lace their dope with things like fentanyl is because the hardcore drug dealers will find out that it's laced with fentanyl, and that's the stuff they want because they're trying to achieve that first big high that they had, that chasing the dragon type feeling. The other big contributor to overdoses are people that have been clean for a while that use again. So your tolerance for heroin is really, really high when you're using, and when you stop using, it plummets almost instantly. When I was doing my internship for my CADC, I did one at a residential agency in Aurora, Illinois, and there was a girl that was mad and she was leaving, and her drug dealer boyfriend was coming to pick her up. And she said, I'm gonna go get high. I've had it. Da, da, da. I said, okay, fine. Harm reduction. You're gonna go get high. Fine. Don't do as much as you used to do. Don't do as much heroin as you did 2 weeks ago, because you will die. That is the biggest fear. People get out of treatment, or they think they're doing okay and they think they can just do a little, or they can do what they used to do. And that's where the overdoses come from. But luckily we're going to talk a little bit about Narcan here in a few. But that is that's pretty much everything I wanted to say, I think, about this on opioids and opioid epidemic and addiction. On the Elmhurst Public Library YouTube page, there's all kinds of great stuff, but there's also a program I did on addiction in general. So feel free if you have more addiction questions. I wanted to focus this more on kind of like opioids and that effect on the family systems. This also is my contact information. Feel free to reach out. That Skype line is one that comes directly to my computer. So when I'm working remotely, I'm available. They set that up for me here at the library during the pandemic. But before I go, any questions from anyone?
Tracy, are there ways we can help as far as encouraging legislation?
Yes, absolutely. Also, I don't want to touch on any hot button topics here, but there's been a fight in Itasca recently, Haymarket Center.
We are supporting that already.
Perfect. Yes. Yeah. I watch those forums and I'm just horrified that everyone is so against that, because there's nothing out here like that. And Haymarket is great. Their center in the city it's like its own universe. Like, it's amazing how big this place is. They have for mothers that can come with their children. A lot of times women don't seek treatment because they don't have someone to watch their kids. Well, come on, bring your kids with. They have all these wonderful things. So yeah, I mean, the basic, the funding cuts to mental health services and substance abuse services, the taking away the stigma of it. Everyone is, the addict, the junkie, the drunk, the crackhead, the da-da-da-da. Well, now it's showing up in people's backyards. So absolutely supporting any legislation we can to get the funding available for this. Like I said, joking around, if I ruled the world, treatment would go past 21 days. Like, how do you expect someone to get well after 21 days? Like, it's just not realistic. We've come a long way. Addiction used to be people looked at it as a character flaw, like you were weak. At least now we are looking at it as a disease of the brain, and something that needs treatment. But yes, any advocating, absolutely.
Okay.
Thank you, Tracy.
You're very welcome. Thank you for letting me share some of my knowledge. I could go on for hours about addiction, but I don't want to bore you guys. But feel free, like I said, to reach out if you have any more questions, and obviously to kind of sell some library stuff. We got all kinds of materials here too, if you're interested in our collection, our wonderful collection.
Tracy, I have a question.
Yes.
In both your example here with Danielle and the family, and with your personal example with your daughter, the first time this person got their medication because of some pain, why are doctors continuing? I mean, I have seen this with people getting a whole jar of painkiller for maybe use of only 1 or 2 days. Why is that happening? With the physicians and the doctors now seem to be responsive to the fact of antibiotics, and they will not give it. They will tell you to take an aspirin. Why are they still giving you painkillers?
So there's a couple different theories on that. One is big pharma is pushing them to do so. They, obviously, it's not a secret that doctors and hospitals might get a little kickback from different big pharmaceutical companies. It has to do with their training. And there is a movement right now for some doctors to be trained more when they're in school, to be trained in addictions. If you think back a few years, you were never asked any questions about alcohol use when you went to go see the doctor. Now I get asked that question. So it's a matter, I think, of educating the doctors, and the doctors kind of getting out of that comfort zone of let me just check this box. This is what we're going to do. This is what works. My clients that I worked with before, I told them you have to advocate for yourselves when you go to the doctor. You are addicts. If you need something, you need to tell them, I have an issue, what are my options for pain? It's just, Carol, honestly, it's a habit with them. Just like, here, you're in pain, here you go. This is what we give you. I mean, they did it with my daughter. Like, okay, well, I was like, well, what's in that IV bag? We're going to give her fentanyl. I said, no, you're not going to give my daughter fentanyl. We're going to start with something a little lower first and move on.
Thank you, Tracy. I want to bring on our next presenter. Mila, could you?
Yeah, hi, Grace.
Hi.
Hi, it's nice to see you.
Us?
I will. Good evening, everybody. Hi. And Tracy, thank you for jumping in as I was a little behind with my day today. It's nice to see all of you. My name is Mila Sagalis. I work with the health department. I have the pleasure of working on a number of different prevention programs, and with our heroin and opioid prevention and education task force, the HOPE task force. Tracy and I got to meet probably at least a year ago. Tracy, I don't even know anymore. Time is COVID has made time stand still somehow.
Yeah, I
stand
call
still
it
and move forward.
PC, pre-COVID, is whenever, everything before March 13th. So yes.
Yeah. So the Elmhurst Library, being progressive and super smart, did lots of training for their staff. And we talked about Narcan, and we're going to talk about that in a few minutes here. But that's how Tracy and I kind of got to know each other. Libraries are one of my favorite things, and I'm lucky to have a good one where I live. And when I went to the Elmhurst Library, I was like, this place is fantastic. So, but the other side of that is that libraries, like lots of public places, are warm in the winter and they're cool in the summer, and during non-COVID times, you can hang out there. And so sometimes, and you have a train station in Elmhurst as well, right? I have 2 of those in the town I live in. Same thing. That's a spot where if I'm looking to get to the city, if I've got, someone I'm waiting for a ride for, it's a shelter, right? So that's sort of how we started talking about Narcan with some of our partners, and libraries have been a big part of that, because sometimes if people are sleeping off some alcohol, or they're using a substance that they picked up off of a stop on the metro, you're going to see them at the train station. They might wander over to the library. And I think Tracy did a fantastic job of kind of talking about the fact that you might not always know who that is. And I'm going to try, Grace, can I share my screen? Fantastic. Okay. So what I wanted to do is, let's see. Here we go. Every time I go up to this top bar, there we go. Okay, perfect. So I'm going to talk a little bit about the HOPE Task Force, and it's the Heroin, Opioid Prevention and Education Task Force. When we first started talking about opioids, heroin was the buzzword, that was the drug. It's still the drug, but it's the drug among other drugs now that we see and we talk about. So this slide kind of speaks to the fact that we have an epidemic, right? And it kind of talks to all the things that Tracy talked about at the family level. This brings it up to, what does it look like nationally? What's it doing to the economy? What are you hearing in the news? Well, with the time that we have put this slide together, 130 people plus every day died from an opioid-related drug overdose. Every day, 81,000 people used heroin for the first time. The bottom number there talks about that's attributed to synthetic opioids. So we never used to hear about synthetic opioids. Like what's a synthetic opioid? Well, fentanyl is a synthetic opioid. A synthetic opioid is one that they make in a lab that Big Pharma makes, or, you know, it's made on the street. It's not like heroin where that's derived from, you know, a poppy plant at some point. That's got to be made. So fentanyl is made in the lab. It doesn't involve you're not making it and growing it in Mexico and bringing it over. That can be done by putting lots of compounds together, and it can be created. So this slide really goes to show you that opioids are a huge issue, and it affects millions of people across our country. It's not isolated to DuPage County or Illinois or Chicago. It's a national issue. We know that prescription opioids are, and we talked, you know, I think Tracy's example of her daughter is a everyday one. Knee replacements, hip replacements, you know, those are painful procedures. You need medication to get through that. But the fact of the matter is that the longer you're using those medications, the more likely that, you know, sometimes people are using them for different reasons than pain control. So that is what, that's kind of the big picture equation here. And as we look at defining what the problem is, we know that overdose deaths continue to increase in the United States. And this was written before COVID really was front and center for us. And we know that during this COVID time, the pandemic has caused an increase in drug overdose deaths and all substance use across the board. So, you know, if you have a mental health issue, being isolated is a difficult thing. If you are someone who is used to daily meetings or in-person treatment, doing that virtually is not the same thing. And sometimes when you go for that treatment or that in-person meeting, that is a way for you to talk to people that accept you for who you are. You have a trust and a comfort level with them, and it's really important to your recovery. You know, it's not always the case that everyone might know what you have going on. You rely on those people in those meetings for that help. So this has been challenging. And the bottom line is that it really does impact the economy. It impacts a number of different parts of the economy. So it's the labor force. We know that people in their prime working age are kind of falling into this bucket of those that are using substances. Companies, 7 out of 10 companies are reporting that prescription drug misuse is an issue for them. It's an issue for them because they know it from looking at their insurance utilization. You know, right now, if you have insurance through an employer, there's a lot of information that the employer knows about about their employees, not individually, but as a group. And so these are some of the ways that people can kind of track how we're doing with treatment, which Tracy's right, there isn't enough, and certainly not in the suburbs. And then also with prescription rates. So the task force has 3 main goals. You know, ultimately it's responsible for advising DuPage County elected leaders on needed development, infrastructure, and policy recommendations. The step that you all took to support Haymarket is a really good example of this. That's your group coming together and advising the community and, you know, whoever else you might have sent that information to, saying, we support having a treatment facility in DuPage County. We know we need it. So that's a good example of some of the things that the task force is looking to do. But overall, they're looking to also provide some level of assessment of opioid use within the county, recommend actionable policies and initiatives, and then measure success from those programs. This is and I think I just want to make sure I'm paying attention to time. So we're ending at 8. Is that right, guys? Give me a, no? Yeah.
We don't have an actual end time.
Okay, all right. I don't want to, so you guys give me some signals if I'm talking too much. So this is a example of the types of folks that are sitting around the table. We have county board members. We have Darlene Rossetti from the Regional Office of Education, Dr. Jurgensen, our DuPage County Coroner, Karen Ayala, our Executive Director for the Health Department. And we each year have a fire chief, a police chief, whoever's kind of sitting at the head of their associations that are at the table. Mayors and managers always have a representative, lots of treatment folks. We also have our workforce development arm, and that's really important because if you have a substance use disorder, if you may have a criminal record because related to the substance use disorder, now you maybe have some charges or you spend some time in jail, it's really hard to be employed. And being employed is an important part of recovery, because when you're not employed, you know, there's not only the emotional issues with that, there's also the bills that come your way, and being into recovery and being able to support yourself with non-drug related activities is a big part of a successful recovery. And then we have community members. So we have folks that are on the task force that have either lost someone or in recovery themselves. So all those folks are providing kind of the advice and counsel that the Hope Task Force brings together. So looking at the framework for success, when we got together, we said this is important work and we need to make an impact. So where are the areas that we think we can make an impact? Well, we want to reduce access to drugs. We want to reduce opiate and opioid use and misuse. And you guys kind of touched on that a little bit about the prescribing. That's really important. That's something that we're working actively on. We want to increase overdose prevention and overdose response, intervention and treatment and recovery, and then substance use education as well. So reducing access to drugs, one of the strategies that we've had in place for a long time is having RX boxes in police stations. So if you go to a police station, and we have a list of them on our website, you can bring unused medication and dispose of it safely. The police station then brings it to us, and we have a waste management facility come pick it up and incinerate it environmentally. So this is really the replacement for flushing it down your toilet. It saves the groundwater contamination, and it really does a fantastic job of having people think about, okay, like for example, you know, when we do our spring cleaning, let's get that medicine cabinet cleaned out, because if you're having your grandchildren over, or you're having a graduation party or whatever it may be, when eventually when we can do those things, you don't need somebody stopping in your medicine cabinet and borrowing something. And that does happen a lot. You know, it's an easy way. Another example is selling your home. If you're selling your home, and back in when open houses were a little more common, you know, we really encourage realtors to have people clear out those medicine cabinets. So that's reducing access to drugs. The other parts of that, number 2 and number 3, and number 3 is a little hard to see. Number 2 is working with our law enforcement. So we have a group called DuMag, which is the DuPage enforcement arm, the DuPage Metropolitan Enforcement Drug Group. And they will talk to us about seizures and kind of keep an eye on drug trends. Our state's attorney is a big piece of this. State's Attorney Berlin has been very active to make sure that people that are being charged, being caught with drugs, are also charged, and that they're appropriately sentenced, and that we have, working with the sheriff's office at the jail, we have some programs in the jail that can help them. And then lastly, supporting the legal action, which is, you know, Tracy touched on that big pharma is a piece of that, right? And we know that big pharma is being sued, that they've been sued. You know, I think they've also declared bankruptcy. So that's a big thing that's a little bit outside of our control, but we do have folks on the task force that are keeping an eye on those lawsuits. Reducing opiate use and misuse. This next one is similar to reducing access. The difference here is that we focus on what one of your members asked about is, why are doctors prescribing opioids to the extent that they are? The good news is that the state of Illinois has a dashboard on their website where they're actually tracking the number of prescriptions, opioid prescriptions that are being written, and they're doing it at the county level. So you can see how many opioid prescriptions are written in DuPage County year to year. And the good news is that's trending down. They're also tracking something where they're looking at the number of opioid prescriptions, and then they're also looking at the number of benzodiazepines. So when, you know, we talk about drug misuse and opioid misuse, sometimes it's not done alone. You know, someone maybe takes an oxycodone or a Norco, something that's prescription, but then they are also taking a Valium or a Xanax. So those are two drug classes that are being looked at, and those trends are being watched. So they're going in the right direction. You know, I think the education is really important. I think medical schools and nursing schools and dental schools are doing their part to actually provide that kind of education. But for a long time, doctors were kind of judged on their ability to control somebody's pain and keep them comfortable. So opioids are kind of a go-to for that. And I think the other part of it is that in our country, we have a culture that is used to solving something with a pill, right? And that's a hard switch to make. It's a cultural shift. We have to kind of look at how we think about pain control and realize that maybe it's a part of healing. And then at the same time, it's a balance to make sure that you're following your doctor's directions and having a conversation with them. So at our website called hope2page.org, we have a section there that's kind of devoted to talking to your doctor about pain. How do you talk to your doctor about pain? Can you talk to them about, Tracy was very open with the surgical team saying, I don't want my daughter to have fentanyl, let's start with something else. That's not always an easy conversation to have. And some of these words are foreign to us, like opioid, opiate, what does that mean? So we have a lot of tools that you can look at online and kind of listen to what makes sense to you and talk to your doctor about pain. We also have several safe prescribing trainings. We have 2 coming up, actually. We have one coming up for physicians and general healthcare personnel, and then we have a second one coming up for oral surgeons, because we do know that as teenagers and young adults get their wisdom teeth out, that is often a time when they may be prescribed an opioid for the first time, whether it's a Tylenol 3 or a Norco or a Vicodin, something like that. That might be the first time that they are prescribed an opioid. So to your earlier point, maybe they don't need a week, maybe they just need 3 days. Or maybe they don't need it at all. Maybe they could just use a non-opioid alternative. So those events are coming up, and I'm happy to share them with you if you'd like to share them with people that you know that would like to attend. Increasing overdose response is something that we have been working on since 2014. And the DuPage Narcan program was started after a very difficult summer in 2013. So if you think back to that time, we had I think we had an overdose death a day, every day for 2 weeks in the coroner's office. And our coroner was fairly new to his job, and being a surgeon, felt that this was unacceptable. If we had people being killed by something else to the tune of 1 a day landing in his morgue, we would be doing something about it, and we should do something about this. So, and I think it's important to realize that during that time, we had people of all different ages impacted. The youngest person was 16 years old, and then it went up from there. So he looked around and got together with health department and county board and state's attorney's office and the police department and said, what can we do about this? And they found a program that was being done in the Boston area, and it was carrying Narcan in their cars. And police, being the first to arrive at a scene, were able to give Narcan at the scene immediately and revive someone. So the way you think about Narcan is it's kind of the anecdote, really. It's the blocker. It goes in and blocks the opioid from working, because when an opioid's working and working well, it's slowing down a person's breath. It's making them very relaxed, so they have respiratory depression, and the Narcan goes in and blocks that so that they can breathe again. They can breathe regularly again. So when you have too much of an opioid, it depresses your breathing, and that's the danger part. So you're depressing your breathing. You're not going to be triggered to take those breaths, and the Narcan goes in and blocks that. So we had to do a couple things and talk about the Good Samaritan law and make sure that people understood that they would not be sued if they tried to help someone with Narcan and it didn't work or the person didn't want it. And we talk a lot about educating folks on the Good Samaritan law, the importance of calling 911. If you don't call 911 and don't recognize that it's an opioid overdose, then the police and the fire department can't come, and they won't be able to possibly revive that person in time. The other part of that is that fentanyl is very powerful. It's more powerful than heroin, far more. And so it works quickly. So intervening with Narcan at the earliest is really important to being able to revive someone and have them recover. So we talked a little bit about naloxone. It is the drug that's used to reverse the impact of an opioid. It's safe, it's effective. We have, in the Narcan program since 2014, probably about a week ago in January, we recorded the 1,000th save or reversal of somebody using Narcan in the Narcan program. So the other side of that is that we've used the police officers and lay people have used the drug far more than that, but it hasn't worked, either because they weren't using an opioid. Maybe they were, maybe it was an alcohol related situation, or it was Valium or something else, or sleeping pills. It won't work on those things, but it also doesn't harm anybody. So the important thing there is that Narcan is not harmful. It's effective for an opioid overdose. It's not effective for other drugs. So it has the limitations. It works for opioids, but not others. You may have heard that the American Medical Association has a policy supporting Narcan programs. The Surgeon General has also come out and said that Narcan needs to be something that people are comfortable using, that they're trained, and that they carry it or have it available to them in public places. So we know that overdose deaths can be prevented by lay people. You don't have to be a medical person to know how to use Narcan. It's actually a nasal spray. It goes right into the nose, and it's very effective. So if anybody, just a show of hands, anybody use like a Nasonex or a Flonase or something like that, right? So that's a nasal spray. The only difference with this one is you only have one dose in there. So you use it once and you throw it out. But it really does help, and it's simple to use. It's very effective and lives can be saved. Tracy alluded to this earlier, but it really does take a long time for people to get into recovery, to achieve abstinence from using drugs. It can take on average 4 episodes of care, and that's an average. Some people will tell you it took them 9 times. Maybe they weren't ready the other times they went. Maybe the recovery or the treatment program wasn't long enough. So using Narcan on someone and bringing them back gives them another chance to recover. So this slide is a little outdated. Right now we're over 1,000 opioid reversals since the program started. We were the first countywide program. That little Narcan unit you see there with the nasal cone, that's what it looks like. Each of those boxes has 2 of those in there, and it is an FDA approved product. This kind of shows you a little bit about the program and tells you over the years how it's grown. The green dots in each of those years represents a successful overdose reversals. So every green dot means Narcan was used to bring somebody back successfully. When you get into the color dots though, you'll see that in 2015, the dark blue is the heroin dots. That's just pure heroin. The gray is the fentanyl dots, pure fentanyl. And the red is a combination. And you'll see that as the years go on, everything kind of grows and goes up. But what ends up happening is the gray dots and the mix of the red dots keep going up. So we're seeing more and more fentanyl, lots of combinations of drugs that you don't see tracked here. So we see lots of that, but looking at the opioids, this is kind of how it looks. This slide this is something that we took a snapshot off of our website. So you can have just a sense by looking at the county here that this is not an issue that's isolated to Naperville or Itasca or Villa Park or Elmhurst or Lombard or Glen Ellen or Warrenville. It's really throughout the county. These numbers look big when you look at them because we've been doing this for 6 years now. So, it's I think it's important to realize that the Narcan that police officers carry, and every police department in DuPage County carries Narcan with them, with the exception of one. So, it's really an important program. Police are doing a lot of hard work, and their efforts are there in front of you. So you can see that they're using the Narcan and it's effective. This slide tells us a little bit about who Narcan is being used on. So if you look at the center circle there, it's 75.2% male. So we have a lot of males in that category. The female area is growing a little bit. In years past, that area was a little smaller, but now that's almost at 25%. In the race area, you can see that 77.6 of the people reversed with Narcan are white. And then after that, 13.9% Hispanic. And then the gray there is the African American, and the lighter blue is other. And then in the far right-hand side, you can see that we have a small group that are under 18. And then we have a lot of folks that fall into the 19 to 29-year-old category, which is the dark blue. And then 43% fall above 30. So, you know, these are folks that are really in their prime years of their life. They should be getting their jobs, they should be completing their education, starting families. And when you think about how long, you know, if you just even think about managing a health condition like diabetes, it's a lifelong condition you have to manage. These are folks that are having to manage an addiction throughout the course of their life when they're starting out very young. So it does take medical care and insurance and a supportive network around you, whether it's your family or friends, to help you stay in recovery. So this slide here tells us, where do we use Narcan? Well, predominantly,
Mila, you're frozen?
Yeah, I was gonna say, does
We're
everybody
not.
see that Mila is frozen?
not
Okay,
frozen.
all right.
Yeah, it looks like you get frozen.
Yeah,
I thought it was just my computer.
yeah. I'm guessing that she's gonna come back, so.
I was going to ask her, you know, all the people that you see on the corners telling us they're homeless, you know, are they finding that a lot of these people are drug addicted, or, you know, I'm just curious, you know, what is the status sometimes with these people?
Well, hopefully when she comes back.
Yeah. Maybe
Yeah,
she'll be
hopefully
able
when
to
she comes
answer.
back.
Or maybe somebody could call her.
I was gonna say, do you have to let her back in, Jan?
I do, but she's not asking to, nobody,
So she doesn't want to come in, no.
nobody's waiting at this point.
No, no.
But I do have to tell you and apologize to Tracy at least for last time. But this time we were much more careful, and we've had a meeting with the Elmhurst Library folks who gave us tips on how not to get Zoom bombed. So we're pretty cognizant of that and pretty nervous about should that happen again.
No, everything went great this time, and we haven't had that issue with ours. So don't worry about it. It happens. You know, I heard about Zoom bombing. Now I can say, you know, I experienced it, so I know what people are talking about, I guess.
Something you don't want to do again.
Yeah, I'm good. We don't need to do that
She
again.
is.
Oh,
She's
here comes
coming back.
Mila.
Oh, there we go, okay.
Oh, she's coming back in.
Wait, oh.
I'm back. Was I the only one that dropped there?
Yeah.
Oh, no. Okay.
Right. Let me make
And
you.
I can wrap this up quickly. I know we're over 8 o'clock.
Okey doke.
try.
Need you co-host again.
Mm.
Where's she at?
Having a little trouble sharing, but I think I can talk about where I was.
Where
All
is
right.
she?
Let me try again to make you co-host.
I can hear Mila, but I can't see her.
Yeah, me either.
There we go.
Oh, there she is.
Uh,
Uh-huh.
Here I am.
There you are.
Okay. Okay, great. Okay, let's go from here.
There we are.
Yeah, okay, perfect. Okay. Okay, so the legal considerations. So basically, anyone can administer Narcan. We do offer a training program, and we're always happy to do those trainings. We started doing them remotely now, just to be able to keep providing service. We have lots of folks trained. We're over 6,000 people trained, 84 program sites, including libraries and social services groups and lots of police departments. And the Hope Task Force also is focusing on treatment and community capacity. So we too support the Haymarket effort. We've supported lots of different treatment opportunities coming into the county. We recently have started a new program in the jail to include Vivitrol, which is one of the medication-assisted treatments that Tracy talked about, so that when people are released from jail, that they don't have those cravings and go back to using and are able to get into recovery. We do have a job training arm there with workforce development to help people get into internships and paid internships so that they can keep recovery going. And we also coordinate with the criminal justice system. We've been very fortunate to have excellent support from our county criminal justice system, both probation and the criminal courts. This slide really is kind of show you the long road that is abstinence. So during the first year of somebody getting into recovery, they're starting to have more abstinent friends. They're having less illegal activity and incarceration, less homelessness, and less use. So, you know, you see that everything here is the word less. It's not a light switch, right? Where they've just kind of changed their life entirely. They're starting to have behavior changes. They're starting to have more abstinent friends and less illegal activity. In years 1 through 3, that's when you see really the elimination of illegal activity. The housing situation is better. That importance of having a job that they can sustain themselves on is there. And then lastly, in years 4 to 7, all those things continue to improve. And really, if you talk about recovery with a disease, you're looking at, 1 to 4 to 7 years, depending on someone's recovery. And that may include using those medication-assisted treatment. It may include something like AA or a 12-step program, or a combination of those things. We know that there's a treatment gap, and Tracy talked about, a bit about this, that we know that we don't have enough treatment. And if you think about, for example, if you went to Haymarket in Chicago for treatment, they do have wonderful services, but when you get out, you still need treatment, right? Well, now you have to find a new treatment provider if you're coming back to DuPage. Otherwise, you're going back to the city. And some of those treatment programs require daily or weekly visits. So it's important to have treatment in your community. It's really important to have publicly funded treatment, because a lot of times, if you look at those age groups, people are not, they're not on their parents' insurance. They don't have access or have a job that provides them insurance anymore. So that means they are looking at a publicly funded program, or using their family's funds to get treatment. So lack of insurance coverage and lack of qualified medical opportunities and providers are big barriers there. And this last one here about our Hope DuPage website, this is what the website looks like. You can see across the gray bar here, there's the different aspects of the program that we talked about. So there's reducing access. If you're looking for that segment on talking to your doctor about pain, you're going to find that in the reduce opioid misuse area. The DuPage Narcan program is talked about in the middle section there about overdose response. And then prevention and education and treatment and recovery are the last two. If somebody's looking for family support or harm reduction resources, we've added those things to the treatment and recovery. So the LTM Foundation has their information on treatment and recovery. Live for Lally and a couple other groups have their harm reduction resources there. And then the treatment providers are there as well. We have a group called the Prevention Leadership Team, and this group focuses on youth, so those under 18. This is an exciting group because they are really looking at where substance use and mental health, where we can make a big impact with prevention. So when you're young, you know, alcohol and marijuana are the drugs that you're looking at when you're young, when you're 15, 16, 17 years old. So we want to do a lot of prevention there. We do talk about opioids, but we really talk about the prescription opioids a lot. If you're using, you know, all sorts of different drugs, we're trying to explain how a prescription can be misused. You shouldn't share it with your friends. You shouldn't take a prescription from somebody else. Those are all important things for people to learn at a young age. We partner with groups like Robert Crown, which is now called Candor. And we actually have a really great youth group called Reality Illinois that focuses on reducing vaping and tobacco use among youth. When we talk about vaping with youth, we talk about vaping tobacco, and we talk about vaping other substances, including cannabis, because that is very much a thing. And need quite a number of meetings themselves. So they have gone to the Elmhurst City Council and talked to them about smoke-free parks. They've gone to the Glendale Heights Parks and Recreation Group and talked to them about smoke-free policies. So they're great advocates. They have a presentation coming up this week by a young man whose name is Stephen Hill. He's currently a law student, but he's going to talk about his kind of his path with substance use, and he's now in recovery. But he's sort of exactly what Tracy talked about in that perfect family. He is one of 4 boys in a very, you know, normal family. And he's the one out of the 4 that took the substance use road. And he kind of talks about what that was like and where his family helped him and where he was able to help himself. So he's going to talk to the kids about that. He really relates to them. He's in his young 20s and he's in law school now. And so he's got a tremendous ability to articulate his story. And then this is sort of how things get funded, because honestly, none of this work happens without money, because we have to make sure that we are doing everything we can to support our law enforcement to have this Narcan program. So we have several grants that pay for the Narcan, so police departments don't have to pay for it. We have a federal grant and a state grant that cover the cost of the Narcan and the training. And we've been fortunate. So, and then some of the other programs that you see on the right, that funding is coming from our law enforcement. You know, we have that environmental program where we dispose of medications. So that comes out of an environmental grant. And we have the support of our sheriff's office, our state's attorney, workforce development, and our county board. And of course, our coroner, Dr. Jorgensen. And this last one here talks about the resources you can find. Struggling with drug use, you see that purple square in the middle. That is the free helpline. That's the Illinois helpline, and Tracy referenced that too. The helpline is useful for any substance use at all. So you can call if you're a person who's looking for treatment. You can call if you're concerned about your child or your spouse or your loved one or a neighbor. It doesn't matter. Anybody can call that line. It's operational 24 hours a day, and they help on all substances. So if you guys take yourself off mute and just take a guess what the #1 substance is that people call about, I'd like to hear what you think.
Alcohol.
Alcohol is the winner. Every time, every month, we get a report, and by far it's alcohol. They also call about cannabis. They call about all sorts of different opioids, and those benzodiazepines come up quite a bit too. So those Valiums and those Xanaxes and things like that. The RX box is the medication disposal program we talked about. And then underneath that is Heroin Anonymous and Narcotics Anonymous. So thank you for hanging in there after 8 o'clock. We're at 8:17. So I've taken a lot of your time. I'm grateful for you sticking around and listening, but I'm happy to take questions if you have them.
Sandy, did you want to ask your question?
Mila, I was just wondering, when I see a lot of these people on the corner, we've seen an increase now they all have signs homeless.
Mhm.
And I'm wondering, are a lot of these people doing this for money for drugs? I mean, do you have do people reach out to them? Do you have any knowledge in that area?
Well, I can't speak for all of them. I think that there's usually a substance use or a mental health issue that contributes to homelessness. So we try to support our PADS network
Yeah.
and our faith-based networks as much as we can. And I know the communities really do a great job with that. I've talked to a couple different groups that, if you're waiting to get on 355 at North Avenue, there's always a gentleman I see there. And I know somebody who speaks to him frequently, and he's not interested in treatment right now. There's a certain amount of control he has on his life. And so the answer to your question is I don't know for everybody, but I think that substance use and mental health are a big part of our homeless problem in DuPage. But we do have a very good network with PADS. And I think if we can connect people to PADS, you've done them a really good service. We also have a veteran shelter in Wheaton that works with veterans, and they do a great job too.
I have a question. We're having a candidate forum for all the members, all the candidates running for school board and all the candidates running for aldermanic and mayoral in Elmhurst. Is there anything specific that you see us asking a question about?
For opioids? For heroin and opioids?
So I observed the school board, and the last school board meeting, the board did vote to join the vaping
Oh yeah, the lawsuit, the
lawsuit.
Jewel lawsuit.
Yeah.
I think that's good. I mean, our school board here in my community had the same discussion.
Yeah.
So I think, from a school board perspective, they've got their hands full with COVID right now. I don't know if they'll,
Right.
between that and budget issues related to, all things virtual learning.
That would also hit, our city council and mayoral, but I'm just throwing that out if you
Well, I do think, the question to ask is always, in my mind, is going back to that prevention leadership team. Are we doing the best we can with our time in health class? Because, especially if I'm thinking about the high school, I have a 16-year-old, there's an unreal amount of information that a health class is supposed to cover. And I think they get it once in high school and once in middle school. Maybe they get a little bit thrown in here or there, but if there's an opportunity if there's ever a time to use that opportunity to have quality substance use prevention and discussion, that is it. And the same thing with parents. I know it's really hard to engage parents, but there's a lot that goes. Vaping right now is so it's so hidden and it's so easy that it's, I feel like with the libraries, they are, just because a kid hangs out at the library doesn't mean they don't vape. I mean, and those things didn't used to go together, right? If the kid hung out at the library, for the most part, you're not really worried about that kid too much. But vaping is across the board. It's all of our kids are at risk for it. It's a concern. It's and it's, it can lead to other things because you can vape a lot of different substances. So the vaping itself, the Jewel lawsuit, that is important, but there's other substances that can be vaped too. I would say the other thing, and this is a little bit of a hot button issue, but our prevention leadership team is working on it. So this is speaking more from the prevention aspect than the health department's role, this is a prevention role with that group, is that they are really looking at the marketing of cannabis. I don't know how it looks in Elmhurst, but in some communities there are billboards everywhere. They're super attractive and nice colors and all that stuff. But there is a concern over marketing and placement of cannabis dispensaries. Are they close to your high school? Are they, are they located in an industrial area where kids aren't generally going to see them?
Like tobacco.
Well, so we have some questions that we're, kicking around, but one of our questions is, for city council and mayor, are you considering cannabis? Because in Elmhurst, they decided not to have cannabis distribution or selling.
Dispensaries.
Yeah.
Dispensaries. So one of our questions was, are you considering, looking at that because of the budget issue?
Yeah. And if they are looking at it, would they, how would they look at the zoning for that? And so zoning, and then the second piece is like, how many do you want? Because once you open it up, I don't think you'll lack applications. So there's density and there's zoning.
Okay.
And I think along with what Mila's saying, like with substance use disorders, it tends to be a lot of reactive, like, oh no, this person has a problem, what can we do? And there's not a lot of proactive. So along those lines of the prevention and the health, what was the number one abused drug? Alcohol. Do we teach our kids enough about that? I know dispensaries are a hot button issue, but there's alcohols everywhere too. And it's probably more dangerous than heroin for some people. So I think that, yeah, anything that can be along that prevention line and kind of being proactive instead of just reacting to something is something that would be really important for the schools and the cities for sure.
Okay, anybody else with some questions?
I was wondering if am I muted? Wait a minute. No,
you're good.
Okay, I was wondering if you talked about drug, like allowing Narcan in jails or when people were incarcerated, that treatment with Narcan. No, I don't mean Narcan.
Oh, with the Vivitrol?
Yeah, with the Vivitrol. I'm sorry. Yeah. Is that something that was mentioned at all in the Justice Reform Bill that was just passed?
I don't know. That was a big bill. That bill I thought was, I don't know that it was treatment focused, that bill, but I can't say for certain. I know that our county jail, our sheriff has been very proactive on having treatment available. So we are thrilled to have his support, and our nursing staff and our behavioral health staff from the health department go into the jail to provide recovery coaching and the injections of Vivitrol. So it's a great partnership between our two agencies. It's fairly new, but even during this COVID time, we've been able to provide virtual support and then still do the injections at the jail in a safe way. So having the support of the sheriff has been great.
Yeah.
Okay, so thank you both for joining us tonight. And as usual, I remembered to hit the record button after Tracy had started. So this
for me.
But that's I apologize, but we'll get this on our YouTube channel. And thanks again. Anybody, any last questions? All right, February. Go ahead, Sandy.
No, I was just gonna say, Tracy, we talk about, you mentioned having it in the schools. They do talk about it in the schools, but I think there's gotta be other ways of dealing with students in terms of how do you cope with the pressure, that kind of thing. they get all the basic alcohol, movies, and all that stuff, but it's the other, and what's happening in their families. It's a combination. It's not an easy just give them more information.
No.
It's a
No.
tough one. It's a tough
In
one.
pre-COVID times, I did a program here at the library with the teens. Once a week I would go into, we have a teen space. I call it just the big glass cage that we put them in. And it's amazing the pressures that they're under. That was their time to just kind of vent to me for an hour. So yeah, absolutely. All those things need to be touched on. It's not just one. There's so many aspects to it. So, yeah.
If you guys haven't heard of this, but Gilda Ross in District 87 put on something called the Glenbar Parent Series. It's open to anybody. So that is, she just recently had John Duffy, who's a psychologist, on, and he really talked about the pressures and the anxiety and the isolation that, the pandemic has brought, but in general, anxiety with teens right now. And I don't know, Tracy, if you're seeing that with your teen groups, but, anxiety is really, seems to be the button for teens right now. When we do our surveys, anxiety comes up high.
And it's even higher now that they're home and staring at screens all day. The teens I've talked to,
We do have a crisis text line that it's a national line. We promote it. I think that's a great thing to have in the schools, and kids are, they have like palm cards they can give each other. There's ways for them to reach out. Mental health first aid and things like that are really important for administrators and for teachers. They all should take youth mental health first aid. Really important.
Absolutely.
And Tracy, being a CADC, knows the importance of substance use education. So I really thank you for your time tonight, and happy to come back some other time and we can talk about something that isn't opioids. But this one is really good to talk about, because right now I feel like with the pandemic we are talking about COVID, and rightly so. But this is only one of those things, just one of the issues, along with mental health, that is kind of in the undercurrent right now.
Okay, thanks, everyone.
Thank you. Good night.
Good night.
Bye.
Stop.